This video is about the bare basics of inguinal hernia, so let's get into it. So what is an inguinal hernia? It is like any other hernia, which is a protrusion from the inside to the out, breaking through the normal covers and usually appearing as a lump. How do I know I've got one? This lump usually appears in the groin, and at least in the beginning may not have much pain, and it is able to go back inside, i.e. it is reducible. So if you're not sure, I think the best thing to do is to go to your doctor and to be examined. This is really important because there are other important causes of lumps appearing in the groin. It is usually diagnosed by a doctor examining you, and that for 90% of the cases would settle the question. In a small number, an ultrasound scan is required. Very rarely an MRI scan is required, and if there is any question of a recurrent hernia about which we are not sure, a herniogram, which is an X-ray examination with dye, that seems to help. If it's not painful, you do not need an operation. That much is true, and you may go on having a hernia and living with it for some time. However, over a prolonged period of time, the hernias, or most hernias, will require an operation. If it becomes really painful and it won't go back in, or if you develop other symptoms such as abdominal pain, vomiting, you must go to the nearest hospital. These symptoms may indicate strangulation, which is the contents get trapped and lose their blood supply and may cause the contents to die, and that is a dire emergency. If you go and see a surgeon the first time around, the surgeon will wish to know a bit about your health, what medication you take, and how painful your hernia is, and then together with you will decide what's the best way of treating it, whether it is watch and wait or whether it is an operation. Repairing with a mesh is one of the commonest operations for inguinal hernia repair. It is safe and has withstood the test of time. The rate of recurrence with a mesh repair is quite low, hence it is favored as a method of repairing the hernia, doing it as an open approach. You may have an operation without a mesh, that is true. However, the evidence currently does not give repair without a mesh much of an advantage. I think both of these are comparable. Most surgeons are trained in repairing with a mesh, and that is how they get best results. The issues with the mesh have specifically been raised in women with pelvic surgery, and the same is not true of mesh repair in groin hernia surgery, as I've discussed in one of my videos. Yes, you can have a laparoscopic repair of your hernia. It may have some advantages in a quicker return to work and maybe a little bit less pain. However, the laparoscopic operation is more beneficial when there are hernia on either side, or if a patient has a recurrent hernia. And a laparoscopic operation for hernia would always require a mesh. So let's just quickly look at the risks of the operation. In general, it's quite a safe operation, and hundreds and thousands and even millions of patients have this operation every year. Bruising, bleeding, seroma, which is a small collection of fluid, and hematoma, a collection of blood that can happen. In some patients, they may struggle to pass urine after the operation, but it almost always resolves. Infection is quite rare. Infected mesh is exceedingly rare. The hernia may come back in 5 out of 100 patients, maybe a little bit less, maybe a little bit more. Chronic groin ache is an issue that we haven't quite surmounted with inguinal mesh repair hernia, and in about 1 in 10 patients may suffer pain in the groin lasting longer than 3 months. There are cutaneous nerves, i.e. nerves that supply the skin around the groin, which run through the plane of the operation. If one of these is injured or cut, then a small patch of numbness may appear, which tends to settle over time. The testicular blood supply also runs through the groin along the same plane, along with the duct that takes the sperm. and if there is injury to the blood supply, then the testicle on that side could initially get bigger in size and be very painful, and then becomes quite small and atrophic. And again, that is very, very rare to happen. Rarely, the mesh may just roll up and migrate to a different location. It may form a collection around itself, and so on. Again, very rare. Keyhole operation in about less than 1 in 1,000 patients may end up having a major bleeding from pelvic blood vessels or injury to the bowel or bladder. This type of a complication, although very rare, is more specific to the keyhole approach. Okay, so if you've had your operation, there are no specific do's or don'ts. You just have to look after the incision, make sure that it is not wet, that the dressing on it is maintained at least for 48 hours, and that you don't take a bath in the first 2 weeks, and protect the wound. In terms of activities, you can drive perhaps within a week. Different countries may have different legislations around that. However, if you're taking medication that causes you to be a bit sleepy, then you're best not driving. You can always sit in the car and just maneuver around and see that you're comfortable and you are able to make an emergency stop, and I think then you're okay to go ahead and drive. The return to work, again, typically is about 10 days to 2 weeks, but it all depends on what type of work you do. If you've got a desk job and if you're self-employed, you may return to work early. For more physical and manual work, I think it's best to wait at least a couple of weeks. Anything else? Avoid heavy lifting, again, for the first 2 weeks, wherever possible. That is to allow the mesh to settle down, and so that it doesn't get disrupted due to the heavy muscular activity. Again, just to reassure everyone that it's a safe operation, and for the majority of the patients, once they are over the initial ache and pain, that it will be well worth it. Thank you.